Hello, my name is Jason Arnold, and this is my third video blog for the Health Informatics course 645, which is Risk Management and Ethics. Today we're going to talk about the risk management professionals and their specific functions, who they specifically report to, as well as the relationship between them and the entity that they report to. First and foremost, I just want to talk about, I'll do like questions 2 and 3 first. With the risk management professionals, of course, they're going to report to the healthcare organization governing board. That specific board is going to be responsible for handling all the or understanding all the liabilities that the corporations may have. So again, that healthcare organization governing board is going to be directly who the risk management professional is going to report to. As far as that actual relationship between the board, first and foremost, the risk management professional's main objective is to educate the board, make sure that the board is aware of all the tasks of risk management, and they're going to have to work closely to prevent, any patient injury or to prevent any medical professional liability, as well as to see the, oversee the corporation's preventive loss from legal liability. Now, they have to do that to make sure that the care is being taken by the hospital. And the way they can do that, if there is like ongoing risk management, like orientation programs, or if they're like, they have the structuring where, again, they're mandated to do these periodic, maybe checks of risk through the hospital, or if they have classes that they're given periodically, just to make sure that people are, being held accountable for the risk that may be present in a hospital. But again, the thing that is most important is that the board is educated, and that's the relationship. It's the education process and the acknowledgement of the risk, things of that nature. Now, as far as the specific functioning of the risk management professional, first they're going to make sure that they can identify all the risks that's confronting the organization, whether it's through staffing or whether it's in the morale, things of that nature. But you want to make sure that all the risks confronting the organization are being actually identified, as well as identifying and analyzing the relationship among those risks. That's kind of like and that's in a continuum of care. So you want to make sure that you understand if there's staff shortages, or if there's like low employee morale, or if there's like a high employee turnover. That is going to be a potential risk for the hospital. So you want to understand not only the risk confronting the hospital, but the relationship of those risks, like why they're happening, how they're happening, why they're happening so frequently, things of that nature. You also want to understand like the organizational like dynamics, and how it can affect, the culture and the environment. Again, that goes into morale, or that goes into like how, if training is bad and those risks aren't being handled in training, let's say initial, orientation, then those risks are going to be persistent. They're going to continue downward because they're being trained with that risk. They also want to make sure that, as far as the risk management professional, that they cooperate organizations' mission and vision and their strategy, because they definitely have to be knowledgeable of that, as well as understanding the organizational structuring and identifying like the lines of business, and that's going to be like engaging staff in specific areas of their responsibility, making sure that they understand that that their business case, as far as minimizing like the prevention of corporate loss from like legal liability and things of that nature. You want to make sure that you understand the business case as a risk management professional as well. And lastly, again, like I said, you want to educate the senior leadership, not only of the board, but the senior leadership in management, to make sure that they're on board and they're understanding things of that nature, because you want to emphasize that risk exposure. So those things are going to be the functions of the risk management professional. Now, specifically in my hospital, as far as an example that I like to give, we had it, well, not to say specifically, but a lot of times we have to make sure that if we have clients that may have like suicidal ideations or things of that nature, or we have evidence that they may be attempting suicide or they have a change of behavior, we have to understand and make sure that we detail and notate those risks. But when these things are becoming a little bit more persistent, then that's when our risk management professional will come in, and then it's mandated that all staff, whether you are direct care or indirect care, if you're in food services or if you're in the janitorial services, or if you're an MD or a psychologist, psychiatrist, you have to have a mandated training. And so what we've done is, again, we had issues where we started noticing people that having suicide ideations, and we started seeing more signs and evidence of people, beginning attempts and things of that nature. So we had to do a suicide prevention training, and that's a risk, again, to understand the medical professional liability, negligence, as well as understanding the business case in case families want to sue because of the things that we failed to do. So in these risk management type of trainings, like I'll talk about these ongoing risk management like orientation programs, we did a suicide prevention training that talked about understanding ligatures or understanding anchor points for these ligatures that can be used on handles or exit signs or hinges in the doors, or can be used through the handles on specific chairs, or could be done on the side of a bed. So we have to knowledge all of the risk areas, all of the points of all the anchor points, all the avenues that a person can use to commit suicide. We have to be knowledgeable of all of those things, and to make sure that we're knowledgeable and we can notice those signs, so that we can have proper communication, so that an incident like a suicide or an attempted suicide where a person is has serious injury from that, because the only thing worse than a person committing suicide is the attempt happening and then they are brain dead, that they have loss of motor functions, things of that nature. Because again, in that example, it only takes about 4 minutes and like 38 seconds, less than 5 minutes, to actually complete suicide. But after a minute, you're pretty much unconscious, and after 2 minutes you're going to be losing muscle tone and muscle usage. So it's really a big deal to understand those things. Hopefully I didn't overtalk. I appreciate y'all's time. Again, my name is Jason Arnold. This is video blog number 3, and well, that's a 3. And thank you for your time. I welcome any questions, comments, criticisms, or concerns. Thank you so much.